Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
A mission to
Delivery of. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to this episode of AFMCTV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Chad Rodgers. Dr. Rodgers, thank you so much for being here.
Yeah, glad to be here.
So a tough topic to talk about today, suicide rates that are on the rise within the ages 10 to 24, I believe. Tell me a little bit about that study and what you're seeing.
Yeah, I think anecdotally in my practice over the last 25 years, it's something that I've definitely seen, much higher rates of depression and anxiety, but definitely we see the suicide rates going up. And the other thing is a lot of personal experience with friends who have lost children to suicide. So when you see the study that kind of shows the number, it becomes even more alarming because then you put the numbers to what you're experiencing. And we are seeing suicide rates going up. I mean, that probably, I think 5% was sort of the increase that we saw. And we also seeing it going up in populations we haven't traditionally seen suicide, like in minority populations and especially among females. It's always kind of been the white male that's been the highest rate. So, that's kind of alarming. So there are a lot of questions. I think we have a lot of ideas and we are gaining more knowledge about why that is, but I think there's still a lot of unanswered questions.
So what do you think are the drivers of it?
Right. So, I think there's a lot of good things. I think we are talking about it more, which I think is really important because it gives language and gives words to kids to be able to express the way they feel. And I think the other thing is that people often hold that inside them and they don't talk about it, and that's probably the most dangerous thing to happen. But I think that people are talking about it a little bit more, so we are a little bit more aware, and we all at some point had these thoughts, right? But we don't have a plan, and we're not going to carry it out, but it's just sort of the way we feel. So sort of differentiating that from what's actually going on. But a lot of people, or a lot of the current thoughts, is really around social media and the impact that that's having on our kids' lives, where social media has been so great in a lot of ways. I mean, it's connected us with people around the world. It connects us when we're apart from each other, allows us to be closer to family. There's a lot of negative things that go on as well. And, I think it's something that kind of develops so fast that we haven't really learned how best to use it, and we're learning now the guidance to give to parents and to give to ourselves about limiting it and how social media could be used for good, but how it also brings us down. So, the effects of cyberbullying are really profound, and I see that a lot, and it's so anonymous and unprotected, and it's really dangerous. But also, kids really live in a social media world. They look at what their friends are doing, and I think that the hard thing for kids to understand is you're seeing a clip in someone's time, like you're not seeing them the rest of the day, or you don't know what's going on outside that picture, but it creates kind of this false world. So you believe everybody else is out having this great life and living this, but then they're really struggling with those thoughts. And it's been good to see a lot of people, a lot of celebrities and stuff that have come forth and talk about, even though this is the life that appears to be on Entertainment Tonight or on Instagram, that this is, I'm struggling. And so I think that has been really helpful in that conversation and about social media. I kind of wonder about the limits of social media as we begin to talk about how to rein that in and how to put controls on it, because I think there's kind of a slippery slope. But because for some kids who are struggling with these things, that may be their only outlet to reach out into the world. But there's also, as much as there is good on the internet, there's some bad. So, and it's kind of a weird phenomenon that we're still kind of trying to navigate our way through.
That's so hard too, and the importance, who would have thought that the importance of a like on a post or to follow someone back and all of how that really affects adolescents and their how they feel important or feel liked. It's really interesting that's really moved towards social media and that desire to be wanted and liked.
Yeah, and now for the American Academy of Pediatrics, which is my professional organization, you see a lot more information on their healthychildren.org, because there's a lot trying to give parents, because I didn't grow up with social media. It's hard for me to remember what it was like not to have all those things, but I didn't grow up with that. But how to help parents navigate that, how to give information and share with their teenagers, how to put limits on things, but also how to use, it appropriately. So I think we're still kind of finding all that out.
So is our healthcare system designed to handle something like this?
Right. I think our healthcare system is struggling to kind of react and to adapt to this. So I think that there was a lot of issues already in the mental health world before the pandemic. I think the pandemic really brought out what the limits were and where the weaknesses were. So I think we're catching up. I think people are really beginning to think about how to kind of improve this area. I think it's really, mental health has always, number one, had a lot of stigma associated with it. It's been its own little world and own little silo, and really trying to bring it into more of the healthcare world, that physical, the PCP, the primary care doctor, and also having services that are available. So you see a lot of services that are very concentrated in certain areas, but like in a rural state like Arkansas, sometimes there aren't the resources we need. So we see the weaknesses that are sort of there. And I think there's a lot of innovation going into trying to figure out how to best respond to kids and how to figure out how to get into adults too, but how to get at people sooner than later. Because what's happening is we really have all these people entering into our healthcare system at the ER level. They're in that suicide place, and we're really thinking in the mental health world as suicide is like the heart attack of the heart world, So by the time we get here, there's a lot of services that are needed. It's very intensive, but it's just like with a heart attack, where there's some things that we could have done to prevent that heart disease that would have prevented that heart attack that would have not ended up in the ER. So we need to start looking at what we need to do upstream in healthcare, and that's not traditionally where a lot of resources have been placed, not a lot where a lot of funding has been placed. But I think this integration of mental health and the traditional healthcare system kind of coming together, it's going to work to solve a lot of those gaps and kind of create some better connections between the two.
And is Medicaid paying for services like this?
They do. So Medicaid, in my lifetime, we saw good parity for Medicaid coverages. So it used to be that people didn't pay for mental health because it was sort of its own separate world. There was a lot of stigma. People kind of felt like that maybe it wasn't even within the wheelhouse of traditional medicine, that it was something, you went to the insane asylum or something like that. And now we have so many more treatments that we know about. So Medicaid provides, coverage for medications and for therapies and services. And insurances are required to do that now. So a lot of times there are gaps though where you may have the insurance or you may have Medicaid, but there's not a provider in your area. Or you may need more intensive services, but those may not be covered by your insurance. So we still are struggling with the area of addiction and getting those services paid for, and so the relation between addiction and mental health issues. So there's still a lot of gaps, and there's a lot of barriers, there's a lot of frustration for people who are struggling in that area. But I think we're making good improvements, and I think that the other thing is that technology has helped a lot, especially around the state, to kind of help connect people with services. So, you may be able to connect with your therapist or your psychiatrist or your healthcare provider initially, but then as far as the follow-up that people need to address those issues can be done in a more remote and telehealth way, which is probably a pretty good solution. It's already being kind of readily used. It's just kind of improving. But if you live in a community that doesn't have good Wi-Fi or good internet services, that creates another barrier. So there's still all these things that we're discovering in the process that we knew about. It's just now the pressure is here to kind of get those things addressed.
And in pediatrics, it's so family based too. How does the caregiver come into play with this when they're meeting with the physician and it's not just about their child? Yeah,
it's really hard in the pediatric realm because you do identify kids that have healthcare needs and you are working to address them. But this is usually people don't have isolated mental health problems. It is usually something that's in the whole family. Just like heart disease gets passed down, so does mental illness, or some of the socioeconomic factors around that are very similar. So, when you're trying to address the healthcare and the mental health of the child, you really have to address that of the family. And so many times I see parents who are really distraught. They're really having some trouble dealing with some of their child's mental health issues when they really, in their intentions, because you do anything for your child, but your intentions are you need to look back a little bit at yourself, and the parent may need to do a little work themselves. Not that they need to be separated from the child or anything like that, but they need to go on that same journey. They need to begin to address their mental health issues, because if your child, if a parent is healthy, if we know that mom is struggling with mental health or depression, if we have to treat that mom's health in order to prevent depression or other issues in the child. So it's really a family issue that should be addressed in a more holistic way.
So should value-based care in pediatrics come into play in this as well?
Yeah, definitely. You know, value-based care is all based on paying for care that improves outcomes, that reduce hospitalizations and stuff like that. So it's really, it's interesting. You see more and more talk because, you know, again, we have kind of thought about heart attacks and strokes and management of heart disease and high cholesterol and diabetes over here, but we haven't thought about it so much in the mental health world. But, you know, there's a lot of things that could be put into place, like screening for mental health, early treatment, early referral, just having community resources that are available to help improve mental health that may improve overall care to prevent you from that ER experience where costs are high and heavy and where hospitalization becomes very expensive. So in the value-based care world, there is a lot of incentive to kind of begin to address things earlier so you don't get to that crisis point.
And you mentioned this a little bit about the resources with internet, and we did have seen a bit of an uptake in online behavioral health treatment since COVID, the pandemic. Do you see that contributing like long term in the pediatric side of it?
I think for sure as we kind of move forward, you know, I think we were so resistant to kind of telehealth because I think so much of medicine is relational, and so it's that being in the room with somebody and I do think that that's still so important. Especially in the realm of mental health, because that's what people are needing is that connectedness with people and and it's those relational things that help prevent things. But, you know, for the follow-up and for the ongoing, and a lot of times people who are struggling need, you know, to be kind of seen a little bit more connected with a little bit more often. And I think that provides a really great opportunity for people to kind of increase the amount of face-to-face or even a voice on the line to connect with people, to help manage their mental illness or when they're in crisis or prevent it from escalating to the point. I mean, you shouldn't have to go to the ER to get your mental health care. I mean, you shouldn't. It should be something that you have more resources for. The other thing is I think there's a lot more opportunity to go online to find people that you can work with in the particular areas. You see different fields emerging like life coaching, which aren't counseling, but they kind of can help with behavioral health changes. So there's a lot of other resources that are available out there. And if you're for people that are struggling with very specific or very what we almost say like niche things, sometimes, you know, the resource may not be here in Little Rock or in Central Arkansas or even in Arkansas, but it may be in a close state, but it may be, you know, a little bit further out, and that connection to be able to do some consultation or to do some work someone outside of Arkansas is another great opportunity to address real specific needs.
Well, thank you so much for talking to me about this. A tough topic, but really great information. I appreciate it.
Thanks for having me.
And that's it for AFMC TV. Have a great day, and thanks for watching.